Hi, Dr. John with NBC News on this Facebook Live, and I'm going to cover a big headline that's happened over the past couple of days and tell you information about what happened, what it means, and what's going to happen going forward, and then answer some questions you have. So if you have questions, please send them our way because I try to get to as many of those as I can. You might have heard my Facebook Live this morning where I was talking about the VRBPAC meeting that happened yesterday and what that means for FDA authorization of the Pfizer vaccine. I'm going to walk you through that timeline and what it means going forward and what's going to happen over the next couple of days. And essentially, when are people going to start getting shots in arms? That's the bottom line to this whole thing. So let me start you in the process. As you know, Pfizer and Moderna are the two companies, manufacturers of vaccines, that have actually submitted for emergency use authorization. Pfizer submitted first. They had their meeting, their VRBPAC meeting, yesterday, which was December 10th. The Moderna one's going to be December 17th. Well, here's what happens. The VRBPAC meeting is the Vaccines and Related Biological Products Advisory Committee. And it says it right in the name. It's an advisory committee for the FDA. It's a committee made up of independent experts. We're talking physicians, public health experts, pediatricians, and there's even a lawyer in there to make sure that legally that things are okay from their perspective. What they do is they look over the data, and in this case here in the U.S., as opposed to the U.K., the U.K. looks over data the manufacturer gives them, and the manufacturer's interpretation of that data. Here in the U.S., they want the raw data, and they want to dig down into raw data. One of the members of VRBPAC actually said that data, if you put it on paper, that if you look at a sheet of paper for the data, those papers would be higher than the Empire State Building. That's going through all that data. They're making sure a few things are happening. Number one, that they have an understanding of the safety profile of the vaccine, the effectiveness profile of the vaccine, and the various age groups, ethnicity groups, medical condition groups, how it affects them both with the safety and the effectiveness behind it. FDA is looking at the same thing, and the FDA actually submitted the information to the public. They put it out in the public a few days ago so we could all get a look at it. And what they found out is pretty interesting statistics from Pfizer. 95% effective. It's effective across age groups. It's effective across ethnicities and effective across medical conditions. In particular, high blood pressure, diabetes, obesity seem to have the same effectiveness on them and safety profiles it did with everybody else. So the VRBPAC looks at that. FDA looks at that, and then the VRBPAC comes up with a question. The question they had essentially is, does the benefit of the COVID-19 vaccine outweigh the risk, and by that they mean the risk of the vaccine and the risk of the ongoing pandemic, for people 16 and above? And they want yes or no on that question, and that's the question they're going to submit to the FDA. And they're going to, once they vote on it, they'll tell the FDA, yes, this is the way we voted, we think it does, the benefit is there, or no, we don't think it's there. In this case, they voted yes by a majority, not an absolute majority, it was not unanimous by any stretch of the imagination, because 17 voted for, 4 voted against, and 1 abstained, and I'll explain that in a minute. So VRBPAC did that yesterday. They had a day-long meeting. In that meeting, the FDA asked some questions as well to get a better interpretation from the experts of what's going on. The reason this committee is so important is because it's an independent committee from the FDA. They don't work to the FDA. They're not beholden to the FDA, and the FDA looks at their advice. Over history, they've taken their advice about 85% of the time. Not every time, but about 85% of the time. Other times, they modify it a little bit, and occasionally they'll say, no, even though that's what you told us, we're not going to do that. In this case, it looks like the FDA will take their advice because they voted to approve it. Now, the 4 that voted no, a couple of those NBC has talked to, and those couple that voted no said the reason they voted no is not because they didn't think the vaccine was safe and effective, but because that 16, 17-year-old group hadn't really been studied as well as the upper ages, 18 and above, and they just wanted to slow that down a little bit. And so they voted no. With my thought is the thinking, well, maybe we can change the statement to 18 and above, and I'd vote yes for that. But the 16 and above passed. That's what they passed on to the FDA. So now, this is as of last night, the FDA now has the advisory committee recommending that 16 and above, they give an emergency use authorization for the vaccine for 16 and above. So now what's going to happen is the FDA is going to take that under advisement, and they're going to go ahead and look at it to decide if they want to put out the emergency use authorization. So they could put it out exactly like that. The thinking is they could certainly change it, because again, this is just an advisement. This is not a mandate. They could certainly change it and say, we're going to do 18 above. We're going to make different parameters on it than what VRBPAC came up with. and they're going to do that probably today. And it looks like maybe tomorrow, but probably today, come out with that. Once they come out with that, this vaccine has been authorized under an emergency use authorization, which means it's a temporary authorization because of the pandemic and the emergency we're in right now, that the safety of the vaccine outweighs the risk of the vaccine and the ongoing pandemic. And so they want to make sure that they're getting people treated as much as possible, as quickly as possible. And then once that emergency use authorization gets signed, it becomes a legal authorization, then trucks will start rolling. And Pfizer has said they are ready to start loading the trucks once they hear about that emergency use authorization being signed. And the thinking is, if that EUA, the emergency use authorization, gets signed tonight, they'll start rolling the trucks tomorrow morning after they've loaded them overnight. If it gets signed tomorrow morning, they'll start rolling them tomorrow night. And then they'll go out to different distribution areas around the country. Now, what happens beyond here? So again, VRBPAC said, yes, we advise going forward with the emergency use authorization. FDA takes that under consideration. They're more than likely going to give the emergency use authorization, and shipments are going to start going out. What's going to happen in the interim is a committee for the CDC meets to give the CDC some advice on what to do, because the CDC then recommends who gets it, how they get it, when they get it, and how often they get it. Those things that, as a doctor, the parameters as a doctor, I need. So legally, I'm authorized to get the vaccine once the FDA gives the emergency use authorization. But I need those guidelines from the CDC as well to tell me who, what, when, where, and how, basically, behind the vaccine. And so the CDC's ACEP meeting, the Advisory Committee on Immunization Practices, is going to meet tomorrow and Sunday to go ahead and come out with those recommendations. When they come out with those recommendations, then we have the FDA, the emergency use authorization, and the CDC with the recommendations on how to dose this vaccine, who to give it to, when to give it to them, and how often to give it to them. And we can go from there. So during the VRBPAC meeting they had yesterday, a couple interesting things came up. Number one, there were a lot of discussion about the 16 and 17-year-olds because the studies had mostly been done on 18 and above, although it looks safe for the 16 and 17-year-olds as well. Again, some people hesitated and said, I want to slow that down a little bit. Let's just authorize 18 and above, but the 16 and 17-year-olds passed as well. FDA is going to talk about that. The CDC is going to talk about that as well and discuss, and they'll decide whether 16 and 17-year-olds can get it as well, because remember, what VRBPAC did is just a suggestion, just an advisement. On top of that, the other topic of conversation for VRBPAC, and FDA and CDC are going to talk about this as well, are the allergies that happen in the UK. If you heard the news, there were 2 patients in the UK, these are healthcare workers, that had a history of severe allergies. They carried EpiPens with them, and they had a severe allergic reaction to this vaccine. It was an immediate reaction. They were taken care of. They were doing well, but it got concerning for the UK, put out a statement saying, if you have a history of severe allergies, don't take this shot at this point. Don't take the shot yet. And that's important because what they want to do is find out, and Pfizer shared with us that that's what they're doing. The VRBPAC said that's what needs to be done, is they're going to look at the patients, look at their medical history, dig deep into that, look at the vaccine, dig deep into what's in the vaccine, and see if they can match all that together to find out exactly what caused this, because it's typically one ingredient that causes this or one thing that causes this, not the vaccine overall itself. And so what they want to do is find out exactly what caused it. Then they can fine tune it and say, if you have a severe allergic reaction to this one thing, then you shouldn't be taking it, but everybody else can. And so again, that's an important distinction. FDA is going to talk about that. CDC is going to talk about that. And I would not be surprised if they came out with similar recommendations. On top of this, the other topic of conversation were about pregnant women and breastfeeding women. They had not been studied, and it looks like they will not be studied for the next few months because of the way these studies work. And typically what happens in these studies, just so you know, Phase 1, healthy adults. Phase 2, there's healthy young adults. Phase 2, they open up the pool a little more. They get adults who are older, different age spectrums. And in Phase 3, it's the spectrum of society. So it's adults, young and old, different medical conditions, different ethnicities. They want to really find out how it's affecting the people they're going to be giving it to. So once they get through that, these are all adults that are not pregnant, not breastfeeding, and essentially looking at that spectrum. Once they get through that, not children either, once they get through that, then they'll start testing it on children because they know it's safe on adults and it looks like it could be safe on children. But they'll start with the older children and work their way down. Right now, Pfizer and Moderna are both testing at 12 years to 17-year-olds. There are plans for them to test it down to age 5, but that looks like that'll start around April timeframe or so. As far as pregnant and breastfeeding women, the plans haven't been told to us yet as far as where they're going to do that, when they're going to start that, because they want to be extra careful, because obviously with the pregnancy, with breastfeeding, you have very young children or developing fetuses that you have to worry about and be concerned with. And so they want to make sure that it's healthy and safe for these adults, then the children, then the breastfeeding and pregnant women. So that's going to be a topic of conversation as well for the FDA and the CDC. So don't be surprised if you hear them saying, yes, this is authorized. Yes, this is recommended for adults 18 and above, maybe 16 and above, of different medical conditions, except for pregnant women, women that are breastfeeding, and people with severe allergies at this point. And then they'll slowly open that up as we find out more information. Number one, they want as many people vaccinated as they can, but as importantly, they want to make sure that people are safe while they're getting vaccinated, because every vaccine, especially new ones, can have side effects. Just want to make sure that we have those side effects covered so people aren't getting them if we know it could be risky for them. So again, just briefly going over this before I start answering questions. VRBPAC met yesterday. They approved their statement saying, yes, we should authorize under the emergency use authorization the COVID-19 vaccine for 16 and above. FDA is looking at that right now, and they're going to decide on the emergency use authorization, which we think will pass. And then ACIP, the advisory committee for the CDC, will look at who needs to get it, when they need to get it, how, and how often. They'll talk to the CDC and advise them on that, and then the CDC will take that under consideration and most likely approve what they say. That should happen within the next 24 to 48 hours. And so then trucks will already have started rolling, distributions will be out there, and by best guess, Monday, people start getting shots in arms. And of course, the first phase, which is CDC, that same ACIP committee about a week ago said, here's how we want to play out this first virus distribution. It's going to be healthcare workers who are on the front lines and long-term care facility residents, as in nursing home residents. Those will be the first ones. And then it looks like essential workers. And then it looks like those with 65 and above with medical conditions that can put them at a higher risk for complications. That's still TBD, to be determined as time goes on. Initially, as first salvo, they estimate there are 40 million doses of the vaccine, which would vaccinate 20 million people because you need 2 doses. They estimate there's 24 million people in that first phase 1A group, so we're going to be a little short there. But production is going on as quickly as possible. So hopefully between that, the Pfizer one, and then next week Moderna on the 17th will do exactly the same thing Pfizer started doing yesterday. They'll go through the VRBPAC committee meeting. They'll get the recommendation to the FDA. The FDA will look at the emergency use authorization. ACIP will meet. CDC will decide on that, and they'll go through the same one every single vaccine, because this is very, very vaccine specific. So now we're working on the Pfizer vaccine, next week the Moderna vaccine, and we'll continue to go from there. So let me see if you have any questions.
If I've had COVID, is it wise to get the vaccine, or do I need to?
So actually, this is a great question. If I've had COVID and I've recovered, should I be getting the vaccine? The answer is overall, yes, you should be getting the vaccine for a very specific reason. When you have COVID and you recover from it, number one, we don't know. That's what's called natural immunity. We don't know much about that natural immunity. We don't know how long it lasts. We don't know what level of that immunity you need in order to fight off COVID, because you're going to have different levels of that immunity based on the viral load when you first got infected, how your body handled it, how long it was in your body before the immune system kicked in, how many antibodies you have afterwards, how long those antibodies last. There's a lot of factors that go into that natural immunity. What we do know is when you get the vaccine, you get that 95% protection, and you get a high level of antibodies based on that protection. And so it gives everybody a baseline for that protection. And so the most experts, and we think the CDC will say the same thing, are essentially saying, yes, even if you've had COVID, go ahead and get the vaccine. However, there's one caveat. The CDC has come out, this is before the ACIP, so they might change it, but as of now, they have come out with a recommendation. If you've had COVID within the past 90 days, or 90 days, essentially, if you had COVID and recover from it, that 90-day period, that 3-month period after you recover from it, you do have some of that natural immunity that so far looks like it keeps you from developing COVID a second time, getting reinfected. And so they're saying in that 90-day window, don't get the vaccine because there's so limited supply. You want to save the vaccine for those who are vulnerable and have not had COVID and don't have that natural protection. However, and this is the big caveat, once you're past that 90-day window, they're recommending that you do get the vaccine. So you're going to need a vaccine. You might be able to delay it a while, but you're only delaying it to help other people out, not because you don't want to get the vaccine. That vaccine is still important. It's just you might be able to wait that 3 months just to make sure other people are taken care of. But at the same time, keep listening to what's happening with the FDA, what's happening with the CDC, because it might be that they as well come out with recommendations that are a little bit different than that.
Is there a big difference between the vaccines, or are they pretty much all the same?
So is there a big difference between the vaccines, or are they the same? Well, the two vaccines we're looking at right now, Pfizer and Moderna, are both mRNA vaccines, and that's a way they're made and a way that the vaccine is delivered into your body and how your body reacts to it. That's a messenger RNA vaccine. These are new vaccines, but again, looking at the clinical trials, looking at what they've done over the past couple of months, they seem to be very safe, very effective. And the good thing is they're very easy to produce compared to the vaccines in the past, which are vaccines that are usually viruses that have been deadened, so that way they can go ahead and inject it in you and your body can fight it off and produce those antibodies needed to fight off the actual infection. And there's a variety of different ways to do it. These two vaccines are almost identical in that, and they both have around 95% of effectiveness. The big difference is the Pfizer vaccine needs that ultra cold storage. The Moderna one doesn't need it, at least for the first 30 days, and so it's going to be easier to distribute, especially to more rural areas. So that's about the only difference you're seeing right now. As vaccines come on board, though, you're going to see differences. AstraZeneca Oxford vaccine is off of what's called a chimpanzee adenovirus, which is a cold virus chimpanzees have. They've taken that, they've modified it so they can go ahead, it can simulate the coronavirus in your body and it can start the immune system process. Right now, the efficacy, the effectiveness doesn't look as high, and they're having some issues with it, so they're going ahead and looking at what they need to do with that. But again, there's a variety of different vaccines out there, but these first two are fairly identical. They're almost the same.
If I have allergies to antibiotics, will it be safe to take the vaccine?
So if I have allergies to antibiotics, will it be safe to take the vaccine? For the most part, yes. But if you have severe allergies to antibiotics, as in you've had an anaphylactic reaction, they've had to give you epinephrine, you've had to be in a hospital for it, then we're going to have to wait and see what the FDA and the CDC say as far as should you proceed with the vaccine. The vaccine does not have antibiotics in it, so you having allergies to an antibiotic, especially if they're moderate and mild allergies, should not preclude you from getting this at all. But you do want to keep your ear open to what the CDC and the FDA are saying.
Do we know yet if it's still going to be a yearly thing or if we're going to get it more in time?
Do we know how often we have to get the shot? Is it yearly or can we wait longer? We're going to find that out, and that's part of what ACIP and the CDC are going to let us know. At this point, people need to get it, and for the Pfizer vaccine, it's day 0, day 21, so 3 weeks apart for the two dosing. And then they'll say you can wait this distance, you can wait this length, you can wait a year or 2 years. And what's going to happen is over time they're going to look at the virus, see if the virus has changed. They're going to look at the vaccine and a person's antibodies, see if they've changed and if they stayed high enough to protect you. And at some point they're going to say this is only lasting 5 years, or this is only lasting 2 years, or it's possible it's only lasting a year. But most experts think at least 2 years, if not more, before you need another booster shot, which is great because that'll get us through this pandemic and get it more under control, which is the main goal here. But again, thank you for the questions. They've been fantastic. And again, looking forward here, VRBPAC has met. They have basically pushed forward their questions saying, yes, we think you should authorize the Pfizer vaccine. FDA's meeting to determine their emergency use authorization, which they probably will do. ACIP will advise the CDC on how people should get it, when they should get it, how often, and the dosing. And the CDC will decide on that over the weekend. And by Monday, you should start seeing first shots in the arms. This is great news because this means that we are finally starting to make those big strides towards getting this pandemic under control. However, the caveat I frequently talk about is even after you get your vaccine, you're going to need to wear a mask. You're going to need to social distance. You're going to need to do all those things that we know help keep the pandemic under control, because we need to make sure that enough people get the vaccine, that the pandemic starts quelling down, that we start getting it under control before we start loosening these guidelines and getting back to a more normal life. And the more we can do that early on, the quicker we'll be able to get back to that normal life. So thank you very much. Hopefully this helps. I'll talk to you on Monday about what's happened over the weekend and what's happening with the shots. But in the meanwhile, go ahead this weekend, you, your family, your loved ones, and everybody else around you, please have a happy and healthy weekend.